Good afternoon, Dr. Haji. Thanks you for joining us. So let's talk briefly about this morning's session in the second day of the GIS mitral and tricuspid tutorial. We opened the session with an excellent case by Dr. Mahmoud Turena, a mitral complex in a shock situation. So what is your insights or what are your thoughts about that?
Yeah, it was a wonderful session. I think as a start, we had a very good discussion about the different transcatheter modalities for mitral and tricuspid valves. It was very case-based. The first session was about the use of M-TEER in cardiogenic shock, and we are seeing more and more patients who are referred for TEER therapy in that setting. We have nowadays large observational data, as Mahmoud showed in his case, where TEER actually can be beneficial for those patients, and it's you can say it's very safe as well to perform it in such patients. His case, we had a lot of learning points from it. The patient had ischemic cardiomyopathy.
And I think many of us have emphasized on the revascularization prior to embarking on TEER therapy. So that was one of the important things. And second point was regarding the choice of mechanical circulatory support or intra-aortic balloon pump. So I know that you have some experience in that. So
yeah, I have a limited experience where we had a patient who had wide flail MR who we needed to transition him to Impella before we do TEER. TEER is possible, I think, in those cases. There will be a little bit challenges with the images and shadowing, but it can be done. In their case, Mahmoud showed that the patient did not require Impella after revascularization. They transitioned them to balloon pump, and they had a very good view of the mitral valve, and they did a successful TEER for that patient with a good outcome.
Yeah, that was like an excellent case showing. But and as we concluded the session, this is not a co-op patient. Those are not yet in, let's say, but you can consider it in like a bridge situation. Moving on to the next case presented by Dr. Mogheri, which is valve and ring case. I mean, we had an interesting insights about the CT and how you have to have an open discussion with your imager about you want it in the systolic phase from the imaging and the new LVOT. I mean, that will define your strategy even. So any thoughts about that?
Yeah, I think they touch based on the Achilles heel of that procedure, mainly mitral valve and ring and mitral valve and MAC. The LVOT obstruction really associated with high mortality, and we want to avoid that. And embolization and stent valve underexpansion is the second thing that we need to look for. In that case, the patient had required intervention because had recurrent heart failure admission, and he had a very sufficient new LVOT area.
It was more than 200,
he was a good candidate. And if not, then you want to think about ways to reduce the risk of LVOT obstruction. You start with alcohol septal ablation, and if you are experienced with the procedure, you can offer those patients lampoon procedures as well.
True. And we concluded our session with tricuspid. So from a standpoint of an operator transcatheter, I mean, still we don't have a good solution for the right side of the heart, and you are good with the tricuspid regurgitation until you're not good. So how do you feel about that? Like, do you think we are approaching a brighter future, especially with the EVOQUE or transcatheter valve replacement by Edwards Lifesciences around the edge or already CE marked? Do you think we're going to have some light in the end of the tunnel, or still we are there?
Yeah, I think you have the largest experience in the region, and you showed very nice cases who you should offer TEER to, who you should not offer TEER to. And we are still, I mean, TEER changed the game in that arena as well, but there are a lot of patients who still are not fit for TEER, and we should really think about alternative therapies. We have the trach valve, but it's almost like a palliative treatment to such patients because you are not treating the actual problem. And we are looking forward for, having the transcatheter valves replacement as a potential therapy in the region.
Thank you, Dr. Haji, for joining in, and thank you everyone for tuning in. We'll see you soon.